Hi, welcome to my channel, Rohit Speaks. And in today's video, I'm going to talk about is what is type 1.5 diabetes. So by the number itself, 1.5, which is in between 1 and between 2. So type 1.5 diabetes has characteristics of type 1 as well as type 2 diabetes, hence called as type 1.5. Now, why do we call it as type 1.5? So in type 1.5 diabetes is basically your own immune system is working and killing your or working against your pancreatic cells, which produces your insulin hormone. And that is also the characteristics of type 1 diabetes. So, but the symptoms shown by the people who are suffering from this is that of type 2 diabetes, which is basically weight loss, excessive thirst, frequent urination, blurred vision. And most probably, this is misdiagnosed in a lot of people, and usually it's happening over 30-year-old. So again, the treatment here would be, first of all, the doctor has to diagnose it correctly, depending on what, if your symptoms are showing of type 2 diabetes, but you don't have enough insulin also being produced, that means you have type 1.5, and you most probably will need injections of insulin. And that is the treatment for type 1 diabetes. For type 2 diabetes, it's usually just controlling the amount of sugar because your body has grown resistance to insulin. Your body is producing normal amount of insulin, but that insulin is not able to take away all the glucose from your blood. So injection of insulin is not the case. In that case, you have to just reduce your blood sugar and make sure you're working out so that your insulin gets back again using the glucose in the body and lowering your blood sugar. So type 1.5 diabetes is nothing but it's a condition of diabetes where your body is attacking your immune system is attacking your pancreatic cells producing insulin like type 1, but the symptom shown is like type 2, which is rapid weight loss, excessive thirst, urination, and blurred vision. And it's mostly diagnosed in people who are over 30 years old. So the doctors or diabetologists or the experts may be able to figure it out. And now, because of much more uh, attention to this, people are looking at the symptoms and then looking at your insulin levels. And if your insulin levels are low and you're showing weight loss and everything, that means you need more insulin in your body. And that should technically help you treat 1.5. And I mean, I'm not an expert, but that's where I would go. And you can ask your doctor to look into it. Also, on other hand, type 1.5 diabetes is also called as latent autoimmune diabetes in adults. I mean, latent means because it happens after a period of time. It's not very instant. It doesn't happen in young people until it's a genetic issue, but usually it happens late onset or it happens later in life. So hopefully, this is a very short video and gives you a little bit clarification on what is type 1.5 diabetes. And in short, it is a form of diabetes uh, um, uh, which has the cause of type 1, symptoms of type 2, hence type 1.5. So with that, I'll see you on the other video. Goodbye for now.